fourth case of the Omicron variant now in India. Maharashtra's first Omicron case has been reported from Kalyan, Dombivli. Let me go across to Vinya Deshpande for more details. Vinya, what further information do we have? Has this person got any travel history?
Yes, Maha, this is a 33-year-old man who traveled from South Africa's Cape Town to Dubai, Delhi to Mumbai. He had initially tried to hide his international travel history, but he developed mild symptoms on 24th of November. Now remember, this is a man who's completely unvaccinated. He is somebody who worked with the Merchant Navy, and that is why he kept on traveling for the last 7 months. All the high and low risk contacts of this person have already been tested. In fact, the government of Maharashtra has said that there were 12 high risk contacts and 23 low risk contacts. All of them have been tested and all of them have tested negative. This person himself has mild symptoms and is currently recovering at Kalyan Dombivli COVID Care Center. So right now, the first case of Omicron variant of Covid19 being reported from Maharashtra. Remember, at least 3,839 passengers have come from high-risk countries to Mumbai International Airport in the last few days. All of them have been tested till now. 344 passengers are the ones whose RT-PCR has been conducted, is what the government says. Till now, there have been 8 patients who have tested COVID positive. This is the first genome sequencing report that has come back right now. And this is the first genome sequencing report that says that one person is positive. So right now, the Maharashtra government says that all precautions being taken, but the 33-year-old completely unvaccinated person himself has extremely mild fever, is recovering, and no contacts of his either in the planes in which he traveled in India or his high-risk or low-risk contacts have tested positive till now.
All right, let me also bring in Runjhun Sharma, who tracks the health ministry here in Delhi. Runjhun, help us understand what is the center saying now. As Vinay is pointing out, this person has a travel history, but contact tracing is being done quite fast and effectively over here. But what is the guidance being given by the center?
The guidance essentially which is given by the center to all states is test, track, treat, vaccinate and COVID appropriate behavior. So it really goes back to basic, Maha. In fact, the health secretary today wrote to a few states. He wrote to Kerala, Jammu and Kashmir, Tamil Nadu, Karnataka, Odisha and Mizoram, pointing out that there is a slight increase in cases in all these states. And in 2 states, at least in Karnataka and Kerala, he said that there is an increase in deaths as well. He also mentioned in his previous letters that he's also pointed out at some cluster outbreaks in the country. That also needs to be monitored. So the 4th case of the Omicron variant now reported from Maharashtra. Before that, earlier today, we reported that the 3rd case, in fact, of the Omicron strain was reported from Gujarat. 2 cases already from Karnataka, so 4 cases as of now, but we will get a bit better picture of the Omicron outbreak in the country once more samples from the genome sequencing, the results of these samples come out. And what I've been given to understand is that the INSACOG members met yesterday evening to expedite this process of genome sequencing so that the results come quickly on time and so that we have a better picture at which rate is Omicron really spreading in the country. But good news again, Maha, is that most of the cases that are reported are mild cases. But of course, having said that, it's really mandatory at this point that we avoid large gatherings and get vaccinated.
Absolutely, because certainly this variant is much more contagious than the other variants that we've seen, including Delta. The severity is, as has been reported up till now, is mild. However, more research and data is certainly required on that count as well. Let me go back to Vinaya for more details on this particular case from Maharashtra. Vinaya, the fact that you're pointing out here is that this person has had no COVID vaccine shots. Now, this is worrying because the government is continuously trying to encourage people to step out and take their vaccine shots, and vaccines are enough in number. What is the reason why this person did not have any of the shots?
Well, absolutely, Maha. And in fact, there's a target of 100% vaccination for at least the first dose in Maharashtra. But this 33-year-old man worked with the Merchant Navy and had been traveling for the last 7 months from port to port. He did not take any vaccines. Now, after he returned to India, and remember, he came from South Africa's Cape Town. He traveled from Cape Town to Dubai, from Dubai to Delhi, and from Delhi to Mumbai. That is where he was, even after he returned to Mumbai, he tried to hide his international travel history only after his brother went to a local private lab for testing and informed the local private lab that his brother had come from South Africa and he was COVID positive. That was when the authorities actually traced back his travel history. So this is one person who has not been vaccinated primarily because he was not in the country in the first place. He has returned now and there is no clarity on after how many days after he recovers from this variant will he be able to get vaccinated. But clearly a cause of concern at a time when the government is going gung-ho about making sure that the citizens go ahead and complete their vaccination doses. The first case of Omicron variant from Maharashtra is a completely unvaccinated 33-year-old man, mild symptoms, recovering now.
Also, Vinya, there has in fact been one of the points that has been underlined is that to keep a very close eye on any clusters that emerge at the moment. What is the situation like in Maharashtra and some of the more vulnerable parts that we have been talking about earlier?
Well, Maha, there are currently two concerns. Firstly, there are sizable populations within a few districts in Maharashtra where we see that vaccine hesitancy has been quite high and the government is trying to convince people to come out and get vaccine. On the other hand, we are seeing that a large number of people, in fact, thousands of people have been traveling from high-risk countries to Mumbai, and it has been another task to not just trace these persons, to get them tested and make sure that their genome sequencing is in place, but also with every COVID positive report of persons traveling from high-risk countries, there is a concern for tracing the high-risk contacts as well as the low-risk contacts, people who possibly came in touch with this person in the flights as well. And that is proving to be a humongous task as well. And that is something that the government is currently focusing on. So right now, the government says that at regional level, it is carrying out surveys to understand the entire pattern of this. At the same time, at least 8 COVID positive patients who have come from high-risk countries from December 1 onwards, their samples have been sent for genome sequencing.
Also, Vinya, what is the number of people who are under contact tracing for this specific case? Do we have those figures?
Yes, we do. In fact, the authorities have given out detailed figures. They've said that 12 high-risk contacts of persons who came in close contact with this 33-year-old Omicron positive person have already been traced. 23 low-risk contacts who were also close relatives of this Omicron positive patient have been identified. All of them have already been tested. They have tested COVID negative. In fact, the 25 co-passengers who traveled with this person on the aircraft have also been identified and tested for COVID, and all of them have been tested negative.
Vinya, just hold on to your thoughts there.